Okay, so
I
hi, good evening, and myself Jagruti, and welcome to today's webinar. We are Opportune Technologies Private Limited, and Opportune is a cloud-based HRMS solution which is used by over 300 plus clients and 3 lakhs plus users across India. We provide end-to-end HR solution, and today, Opportune in association with Quantum has organized this webinar for our esteemed clients wherein our speaker is going to explain you about the importance of health checkups and health. And every month we organize such kind of webinars for our employees and for our clients. So hope you guys are excited for this session. And yes, thank you, Chetna, for organizing this session and would like to request you to take it forward.
Thank you so much, Jagruti, for the introduction. So, good evening, everyone. This is Chetna here from Quantum CorpHealth. I hope you all are doing great. So, as Jagruti said, that today we all are gathered here virtually for the webinar, which has been organized by, of course, Opportune in association with Quantum. And yes, so we have with us today Mr. Rajesh Jain. He is a business development manager at Quantum, and he's going to give you the insights about Quantum. I mean, he's going to tell you what is Quantum all about and what all services Quantum provide, and then accordingly we can go ahead with the session. And then Dr. Sayali would be taking ahead the session and giving you the insights about the topic. So I would request Mr. Rajesh Jain to just take it ahead.
Hi, good evening, team. You can hear me?
Yes.
Okay. Dr. Sayali?
Yes, sir.
Yeah, please share the PPT.
Yeah, we have already shared.
Okay. So I'll just give you a short brief on Quantum CorpHealth Private Limited. Uh, Quantum CorpHealth Private Limited is a decade-old company, and we provide end-to-end medical services to the corporate sector as well as individuals. In medical services, we provide pre-employment health checkups. We provide annual health checkups. We also provide OHC facilities like in-house doctors, paramedics, ambulance services to the corporates. So these are the services like what we provide. I was just telling you: annual health checkup, pre-employment health checkup, doctors, paramedics, ambulance, COVID-19 testing. We have done a lot of work for corporates doing COVID test and all. Then we also do corporate health audits and webinars, like such webinars. Like today we are having webinars. So on different topics, we conduct webinars for the corporates. We also provide teleconsultation. Uh, then we also give pre-policy health checkups for the insurance sector. We also provide smart medical devices to the corporates. Next slide. Yeah. Now, all these services we provide pan-India, across India, because we have more than 2,500 plus medical centers tie-up across India. To name few are like, NM Center, Suburban, SRL, Apollo. So all these certified, ISO certified and NABL certified centers we provide to the corporates with their branches across India. We also give centralized monitoring system through which all the reports and everything comes to Quantum. We scrutinize them by our in-house doctors, and then we give the reports to the HR team of the corporates. Seamless medical history. We also keep all the records with us in our MediLocker. Swift response 24/7. As it mentions, we give response and replies to the HR team and corporates on whatever the medical done cases. We have now built portal. Through that portal also you can see all the details and everything. quality control measures. Hello.
I would request everyone to put their cell on mute, please.
Yeah, so we also follow strict quality control measures in-house, plus wide range of services we provide, as I mentioned to you earlier. Next slide, Dr. Sayali. So these are the few names of the diagnosis centers pan-India where we are working, and we have tie-up with them from last more than 10 years. Plus, we have tie-up with the hospitals also, like Raheja, Hiranandan and all. In clientele list, we are working with Tata Group of companies, Aditya Birla Group of companies. Abbott is our client, GMR, Dabur, HDFC, BSC, DMart. So, and like, all these corporates, we are working with them from last so many years, and we are providing them medical services like pre-employment checkup, annual health checkups, and, overseas services. So any requirement or assistance in regards to the medical services, you can definitely get in touch with us or to Opportune, and we'll be happy to help you in medical services field. Thank you very much. Over to Chetna.
Thank you so much, Mr. Rajesh, for the introduction of Quantum and giving us the insights about Quantum. So with that being said, I would like to introduce our today's speaker, Dr. Sayali. She's MBBS doctor and she's also a Quantum's panel doctor. She look after certain consultations at Quantum and she's also into different projects. So I would really appreciate if Dr. Sayali could take the session ahead. And everyone, if you have any questions related to this session, we have kept the Q&A session at the end. So you can just note down your questions and ask accordingly at the end of the session. Yeah. Thank you so much. Over to you, Dr. Sayali.
Yes, thank you, Chetna. Yeah, so hi, I'm Dr. Sayali Patil. Yeah, so we'll just start with our session today. The topic was basically the health issues what we face today, every day, and also what precautionary measures we'll have to take during all the sessions out. Okay. So basically everyone knows who this is, and also if no one has an idea, everyone came to know this fellow when we had the meme that he met the Prime Minister with a crumpled shirt, right? So everyone knows him. He was a big stock market king, and he was net worth was hello. Hello. Yeah. Can everyone hear me?
Yes,
Yes,
Dr.
Sayali.
We can hear you.
Okay, okay. So this personality is Mr. Rakesh Jhunjhunwala. So he was a basic stock market king and a net worth of 46,000 crores basically. So he had an issue with his health, a lot of issues during his last times. So the time which he was facing all the issues. So the quote by him was that he did not invest as much as time in his health. So my worst investment has been my health. I would encourage everyone to invest the most in that. So that is what his last encouragement words were. Okay. So let us begin with what is health actually. Okay. We have health. Basically, health is a combination of all the three factors. That is your social health, your physical health, your mental and emotional well-being. Okay. Health, as is defined by the WHO, is health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Okay. So now we have like the changing concepts of health, basically. The first, we have the biomedical concept, the ecological concept, the psychosocial concept, and the holistic concept. Biomedical means we actually say that the absence of disease, basically. We have a lot of issues, we have problems which we are unable to solve, like, suicidal thoughts, depressions, and everything. So these all kind of things come in your biomedical concepts. Ecological, basically, we have, this is a dynamic equilibrium between the man and the environment. How do we connect with the nature? How do we have all our connections, like the breathing cycles and everything? And also, if like there is a maladjustment of human body to the environment, you are not able to adjust with the environment you are living in. Okay. Also, like the hygienic habits which you have, like if the water provided to you, like the surrounding you are staying in, if it is not comfortable to your body, so this is the ecological impact on your body. Psychosocial, nowadays a lot of like people we have met, they like minor for minor issues, they have psychosocial issues. Like we have met a lot of influencers, they are like, we don't have a lot of followers, so they are going into depression for that. Our mental health is nowadays affected by smaller things, like social, psychological, like cultural, economic, political factors. We have so much news and everything going around, so it is kind of like very much burden to our health for all these things. The last approach is the holistic concept. It is kind of all these factors, like all sectors of the society. How do they affect your health, your well-being? It has been portrayed in the holistic concept. The health implies sound mind in a sound body, in a sound family and sound environment. Actually, this whole statement, like the sound word, is kind of used a lot because we need a holistic, like the 360-degree angle of your health to the surrounding and to all the people around you. So medical world today what we do is like, if you have some kind of pain, then only you go to the doctor, then only you take the treatment. But this is not actually the ideal way. The ideal way is you'll have to take your health beforehand. You will keep it prioritize your health. First is you'll have to take prevention regarding some things, like if you are in a polluted environment, you'll have to use mask and everything, kind of preventions which will help further diseases to come under control. Okay. So ideally it has to be now the medical world, what we do, we have the disease, then we do the tests and everything, and then we get the treatment. But ideally it has to be, we take the prevention methods, and if yet you have any kind of issues going around in the body, then you do the disease diagnosis, screening, and the treatment. How do you get a disease, basically? So getting into a disease is like there is an agent, you live in an environment, and you basically are the host. Now, this is actually like a true thing known by everyone, because COVID-19 has got us everyone into like, the host, agent, and environmental triad. Actually, so everyone knows basically what this is, but still I'll like explain you with the example of COVID-19. So let us take into example that COVID-19 is the agent. Okay, you are staying in an environment basically, and the host is you guys. So basically all these three factors help you, or like taken into consideration, they lead to a disease basically. So here we have some kind of a disease which are communicable and non-communicable. Communicable is kind of, they can spread from one to another. Like if you are sitting in the common space, you use common stuffs, materials and everything. And non-communicable diseases are that those which won't spread to anyone if you have them. Okay, so communicable diseases, we have a list of them, that is the TB, leprosy, HIV, COVID, malaria, dengue. Okay, non-communicable is diabetes, hypertension, chronic kidney disease, hypothyroid, heart attack, malignancy, or any type of cancer. Okay, so basically, what is prevention? Prevention is objective to intercept or oppose the cause and thereby the disease process. We are taking beforehand processes like to not to gain weight, you are exercising regularly. Okay, then if you have any kind of in your genetics, in your family, you have diabetes running. So it is a tendency that in time you will also have the disease. So beforehand, what you are doing, you are just cutting down the sugar intake every day which you have. So that is kind of a prevention level. So prevention basically we have in 4 steps, that is the primordial prevention, primary, secondary and tertiary prevention. So primordial prevention, prevention of development of risk factors. This is with the example, if you're any parental side, they have hypertension or diabetes. So you are controlling your diet itself from today. You are avoiding sugar, you are avoiding salt intake, you are making like lifestyle changes, like food habits, you are taking into consideration itself. Okay, no smoking, no alcohol, good education on health. This is the primordial way of prevention basically. Primary prevention, that is if you have, means there are some kind of symptoms you already have started, so risk factors have already come, that is the symptoms have started. We take into example like if you have kind of in your gene, you have diabetes running. So now you have kind of you did your blood test and you have been detected that your HbA1c levels are slightly on the borderline. So this is kind of a risk factor, that is the doctor will tell you that you are a pre-diabetic. So what now? Now you start taking primary preventions, action taken prior to onset of disease. You are not a diabetic, but just a pre-diabetic. So now you will start taking precautions. You will start having less amount of sugar. You will start exercising. Okay. So this is primary prevention. Intervention at pre-pathogenous phase, loss of weight, regular exercises, immunization, like we had in our childhood, we had booster doses, then we have doses for influenza and all. This is primary mode of prevention. Okay, use seatbelts and helmets. Secondary prevention, to halt the disease process to prevent complication. Now you already have the disease. The secondary way of this is now you are taking into, you are going to the hospital, you are taking proper doctor's consultations, you are taking proper medications, you are exercising, everything. This is like your secondary prevention. Treatment and hospitalizations, if you are if you have hypertension, then you take antihypertensive. If you are diabetic, you take anti-diabetics. If you have thyroid issues, you take anti-thyroid tablets. And if any kind of infections going around in your body, you take antibiotics. Now tertiary prevention is like you have any kind of like disability, you had met with an accident or something like that. So then we have like physiotherapy or we you are bedridden, but you take precautions after that. If you had a proper cardiac arrest or something, the recovery period after that is called your tertiary prevention. Okay, so for examples, here we have the cardiac rehabilitation program, the physiotherapy for stroke patients, arthritis rehabilitation. Okay, so what is basically the importance of regular health checkup? you actually, you guys must have noticed that our day-to-day life, we really don't take care of our health that much. We tend to eat junk. We also, like, skip meals. We the intervals between our meals is too long. So that is why, like, this is kind of over the period of time, this is uh, causing an aid to your health issues. So basically, why the regular health checkups? Why we doctors, we push you to the annual health checkups? Because as such, if there are some issues which can be, sorted at the base levels by without medications and everything, we can, get to know these levels by your regular health checkups. So basically, aimed at really early detection and diagnosis before onset of actual symptom, corrective measures before onset of symptom, maximum health benefit. Yeah, so if you, like, for the example which I gave, if you run your blood test every year or every 6 months, and in case if you are a pre-diabetic, so you can, cut down your level of sugar, and before you turn into a diabetic, you can, actually get down those levels, and you can be healthy and fit within the next 6 months. Okay, health screening. Now, this is like kind of an informative thing what we have. So this is a health screening for the age from 40 to 64. Okay, so we have the levels, basically blood pressure. It has to be done. The cholesterol levels, the diabetes, kidney screening, colon cancer, dental examination, ophthalmic screening, prostate exam, lung cancer, breast examination, mammogram, cervical cancer screening. So these basically are the tests, like if you are in this age group, or like your parents and everything, yearly they should screen for all these things, because for nowadays anything can erupt, and so it is better that you keep all these tests into account, so all your organs are in place. Okay, so this is the annual health checkup. We have the complete blood count, the fasting, and the PP sugar. This is for your diabetes levels, HbA1c for the same, your lipid profile, your thyroid profile, your liver function test, renal function test, ECG, screening for prostate, cervical pap smear, mammogram, urine analysis. So yeah, there are like people who are nowadays opting for arranged marriages, or people meeting on so much social websites. So basically, like before checking their CV or something, I would recommend you guys to screen them for all these tests, because there is a high tendency that these tests may not cause any kind of issues ahead. So stay healthy, and if any queries, please do ask.
Dr. Sayali, thank you so much, and really appreciate the importance which you have explained us about health, and you have also explained us the importance of health checkup. So that's really great, and it's there's this saying that prevention is better than cure. So that is what I would request everyone to get done their health checkup once in a year or twice in a year, to just avoid all the things which we come across in the future. So thank you so much, and thank you so much for the session. And if anyone has any questions, we can have it. I mean, Dr. Sayali can answer your questions for sure. Jagruti, you can ask whether anyone has any question.
Sure.
Or else you can unmute yourself and ask the question. That is also fine. And we also have the chat box. You can drop in your questions over there. We can address them.
Hello.
Yes.
Hello. Yeah, myself, Parag here.
Yes, tell me.
I'm assuming that majority of the audience over here is, they are white collar jobs who sits, 9 hours or 10 hours a day on a desk.
Okay, okay.
Usually, problem what we observe is they are facing a neck pain issue or a back pain issue or a dry eye issue. So, what is the recommendation or steps that they should follow so that we can avoid this? I mean,
Okay, okay. So I would just recommend like people who have like sedentary lifestyle, like working for 8 to 9 hours a day. So like in between breaks, like every hour, that is actually not possible, but every 2 to 3 hours, they can, just take a walk towards like in the office itself, so that they are not sitting for a really long time, long periods. Okay. And also like for the neck pain and everything, while sitting on the chair or like using the computer, they should actually like maintain their posture. And even if like in the morning they have a bit of time, like 15 to 20 minutes, they can follow some stretching exercises, yoga, so that these things are going to affect your health, and they'll like help you the muscle spasm and everything.
yeah, thank you.
Okay.
Okay. I hope your question was answered, sir. So we have the next question from Mr. Rohit Jain. He's asking if there are deficiencies found in the annual checkup, example, low good cholesterol or excessive bad cholesterol, etc. What should be done as a next step?
Okay, so now first we'll just this thing will be taken into consideration by your family doctor. But if the levels are not that high, and if you are like your age is not that means if you are in your 30s or in your 40s, so what we'll do, we will first make lifestyle changes, your diet changes basically. We will give you, if your the good cholesterol is less, we will give you omega-3 supplements, which will help you boost your good cholesterol. We will help you with the diet, your exercise. First, only these changes will be done. We will ask you to do these changes for next 6 months. After 6 months, we will ask you to repeat your lipid profile. And yet, if the levels are high, then we will put you on the medication.
Thank you for the question, Mr. Rohit Jain. Yes, anyone else has any questions?
So actually, if no one is having any kind of questions, I would like to ask. So when was the last time you guys had your like annual checkup, or like had any kind of checkup which was done before, like as a prevention method, not because your doctor suggested you or you had some kind of pain or something like that? So when was the last time you did it?
I think like everyone can drop in their answers in the chat box so that we get to know when was the last time they did their health checkup. Yes, we would love to hear your answers. I hope I'm audible to everyone.
Yes, Chetna.
Yeah. Okay, so I'll be the first person to share my answer. So I did it, I guess, 1 or 2 weeks back.
Okay, yeah. And Chetna was deficient in vitamin D and vitamin B12, and she's been taking prescription medications with me.
Yes, thank you so much, Dr. Sayali, for the consultation.
So I would like actually request everyone, if you like kind of there. I know the schedule and everything is very much packed up. You guys are having work related issues, stress and everything, but you just need every day 20 to 30 minutes for yourself. You just you can do anything, the sport of your choice. You can jog, you can walk, or you can just in case at home you can go for like minimal exercises like skipping, then also you can do yoga. These are the things which will help you down the line, that is the coming 10 years.
Yes, anyone has any questions? I think the concept is pretty much cleared with everyone.
Yes.
Yes, Jagriti, if would you like to ask anything?
Okay, so I would like to thanks a lot to Dr. Sayali for this wonderful session. This is a very informative webinar for us, and I hope everyone like our participant has also gained lot of health related knowledge. Thank you again, Mr. Rajesh and Chetna, for this session. Also would like to thank you our participants for their time and the participation.
Yes, thank you so much, Jagruti. And also, I would like to thank you, Mr. Dhwani, for giving us this opportunity to conduct this webinar. Yes, thank you so much.
Thanks, team.
Yeah.
Sure. Thank you. Thank you, everyone.
Thank you all.
Thank you.
Thank you very much.